Hey everyone, I'm Dr. Bosnak and welcome back to another Naplex Prep YouTube episode. Today we're shifting gears to talk about public health. You might think this is all about big picture stuff, but trust me, public health topics come up more often than you'd expect on the Naplex. Whether it's vaccines, community health strategies, or managing infectious diseases, this is the kind of knowledge that can set you apart as a well-rounded pharmacist. So let's get into some questions and break them down step by step. First up, a classic public health scenario that often appears on the Naplex: immunizations. A 65-year-old woman comes to your pharmacy for her annual flu shot. Upon reviewing her immunization record, you notice she has not received any other vaccinations in the past 5 years. Which of the following vaccines should you recommend in addition to the flu vaccine? So what's the first thing that jumps out? The patient is 65 years old, which means she's at that sweet spot for some key vaccines. Let's break down each option. Shingrix. The CDC recommends the zoster vaccine to prevent shingles for adults age 50 and older, so Shingrix is a big yes for this patient. Pneumovax 23. Pneumococcal vaccines are also recommended for all adults 65 and older. There's actually a combo with Prevnar 13, but since this patient hasn't had any vaccines in 5 years, Pneumovax 23 is on the list. DP. Tetanus boosters are given every 10 years, and if she hasn't had one in a while, it's a good idea to give this too. So, the answer is D, all of the above. She needs her flu shot, zoster vaccine, pneumococcal vaccine, and a tetanus booster. It's an immunization party over here. Takeaway message: if for older adults, especially 65 plus, keep an eye on those key vaccines: shingles, pneumococcal, flu, and tetanus. The Naplex loves these questions, so don't miss easy points. Next up, let's talk about smoking cessation, a huge public health initiative. A 50-year-old man comes to your pharmacy asking for help to quit smoking. He smokes 1 pack per day and has tried to quit several times using nicotine patches. He has no contraindications to any medications. Which of the following would be the most appropriate first-line recommendation for this patient? A. Nicotine nasal spray. B. Varenicline, Chantix. C. Bupropion, Zyban. D. Counseling and behavioral therapy alone. Here's the thing, smoking cessation is such a crucial part of public health, and there are lots of ways to approach it. Let's break down the options. A. Nicotine nasal spray. This can be helpful, but since he's already tried patches, you might want to go with something stronger. B. Varenicline, Chantix. This is a first-line option for many patients. It's highly effective, especially if nicotine replacement hasn't worked for them in the past. C. Bupropion, Zyban. Another first-line option that works differently than varenicline, making it a solid choice, especially if the patient is concerned about side effects. D. Counseling alone. While this is always a good idea, most guidelines recommend combining behavioral therapy with medications for the best results. So, the answer here is B. Varenicline, Chantix. Given his history of nicotine patch use, varenicline is a strong next step. It's one of the most effective smoking cessation tools out there. Takeaway message is, when you're asked about smoking cessation on the Naplex, remember that varenicline and bupropion are the top choices, especially when nicotine replacement hasn't worked. And don't forget, counseling is a vital part of any quit plan. Alright, here's one on infectious disease control, definitely a hot topic in public health. A local health department reports an outbreak of meningococcal meningitis at a nearby college. The CDC recommends chemoprophylaxis for close contacts of individuals diagnosed with the disease. Which of the following medications is recommended for chemoprophylaxis? A. Ceftriaxone. B. Ciprofloxacin. C. Rifampin. D. All of the above. A. Meningococcal outbreaks. Classic public health drama. Let's go through the options. A. Ceftriaxone, a solid choice here. It's given as a single IM injection for prophylaxis. B. Ciprofloxacin, another great option, especially because it can be given as a single oral dose. Super convenient. C. Rifampin, also a recommended agent for prophylaxis, but it requires multiple doses over a couple of days. So, the answer is D. All of the above. Any of these medications could be used depending on availability, patient preference, and possible contraindications. When it comes to public health outbreaks like meningococcal disease, the NAPLEX will want you to know the recommended treatments for prophylaxis. Ceftriaxone, ciprofloxacin, and rifampin are your go-tos. Alright friends, that's it for today's episode on public health. As you can see, public health is more than just big picture policies. It's about the decisions we make every day as pharmacists that keep our communities healthy. Whether it's making sure older adults are up to date on their vaccines, helping patients quit smoking, or preventing disease outbreaks, this is the stuff that really makes a difference. As always, if you're finding this helpful, don't forget to subscribe and share with your fellow future pharmacists. Keep grinding, keep learning, and I'll see you next time. Happy studying and stay awesome.